at this year's ASCO meeting, Dr. Lonial presented the results of the ECOG study, where patients were randomized to either lenalidomide or observation, and it was a randomized phase 3 study. And in this study, we saw a significant reduction in the risk of progression with lenalidomide treatment, 91% at 3 years progression-free versus 60% with the observation arm. Very impressive hazard ratio as well. And so this suggests that len maintenance is favorable. However, there's some limitations because first, this study included all types of myeloma, smoldering myeloma, including some low-risk patients and intermediate risk, and those didn't seem to benefit as much because their natural history is better. So that's one challenge, and when we look at this truly high-risk component, it was a relatively small number. The second thing is we don't really know a lot of details about the endpoint. So for example, how many patients had CRAB symptoms in the observation arm that were minimized by the use of len maintenance? We don't yet have PFS2 or overall survival data, obviously. There was concern about some toxicity with higher rates of secondary malignancy, and also 50% of the len treatment arm actually discontinued due to toxicity. So I think what this study tells us is that we are on the right track with asking these questions of treating smoldering myeloma, but I think we need a little bit more work. And the other part of my talk, I'm thinking the way we think about smoldering myeloma, I think, needs to evolve from looking at patients just as a photograph to looking at a movie. And what we showed in our data is it's not just how patients are risk stratified at baseline, but what happens to them in that first year of treatment. And those patients whose M spike goes up, light chains go up, whose hemoglobin drops, but none of them meet CRAB criteria, those are the patients that probably merit further study. But that needs to be further validated. But I think it's an exciting time to look at this earlier treatment question for myeloma, smoldering myeloma patients.